the new ranking member of the committee, Ms. Wolarski, to inquire.
Welcome to this historic moment. Thanks, Mr. Chairman. So much appreciate it. And you know, I just think it's interesting, and I've been thinking about it even during this recess, listening to all of you on the panel, and again, so thankful that you're here. But I think it's interesting that you're actually hearing us as members talk about how horrible our state is. My state of Indiana has one of the strongest economies in the country, and we are third from the bottom on this issue. Yeah, it's just appalling, and as I'm sitting listening to my colleagues, and we're all sitting here saying, this is such a big issue, and you know, I can't help but think a couple of things. Number one, that when we look at the success of the McVie program, and I'm the ranking member on what is now like the Worker and Service Employee Subcommittee that this actually falls under. We're going to be looking at this in depth, I know, as the year continues. But I think it's really interesting that one of the things that is an advantage here is this is a bipartisan bill. So everybody up here is on board already with the McVie program, funded into 2022 now. But you know, I'm wondering if we're not, as we're talking about this, finding a solution to this at the same time. Because I'm sitting here thinking to myself, we've already funded McVie. We could be looking at a potential expansion of this in the very near future, because one of the things that McVie relies on is training to go into homes and to visit. And McVie already basically tells states and has mandates out there, you know, establish your most vulnerable people and start funneling all those resources into vulnerable people groups. And start there and then expand out of there. And one of the advantages we're talking about is people looking like people. And the other advantage of McVie is a lot of the people that actually are the trainers in McVie are right out of the McVie program. Somebody came in and trained them too. And then after they had their kids and were successful and were healthy, they go back into these same homes because they live in the same neighborhoods. And it really is almost a friend-to-friend kind of relationship. But I think that I'm very interested. I did some investigation in the state of Indiana as well as to why do we have the strongest economy, one of the strongest economies of the country, and why are we third in the nation in this problem? And a lot of the local organizations on the front line that I talked about the just the pandemic use in our state and in our area of drugs. And so, Dr. Hallier, I just wanted to address to you the question of, as you look at these stats and these numbers, and as we continue to talk about this, and I look at this with great optimism, that I think we could use we could certainly start quickly with expanding a program or looking at really putting our attention on the McVie program. But there is an article, the American Journal of Obstetrics and Gynecology, talking about the fact that between 2007 and 16, pregnancy-associated mortality involving opioids more than doubled. And I know you guys said that you guys had reports you were waiting for on the opioid problem, but what models of treatment have you seen to be the most effective in helping a pregnant woman with a substance abuse disorder get actually healthy and stay clean? Is there anything you've seen so far that you can kind of lend that wisdom to us?
Medication-assisted treatment is one of the best ways to address opioid use disorder for pregnant women. There is also a recent study looking at maternal mortality from drug overdose in the state of Massachusetts, and they provide some very interesting information that talks about the year after delivery being a very vulnerable period for these women. They're also looking for additional data, but programs that implement medication-assisted treatment. I also want to mention to you that the Alliance for Innovation on Maternal Health also has a bundle for obstetric care of women with opioid use disorder. And one of the really important things about this particular bundle is it extends participation outside of the hospital system into the clinical care of women. So this is one of the broader bundles that addresses care during pregnancy and not just at the time of delivery. So implementation of the opioid use bundle is something that could be recommended.
Gotcha. And I just wanted to say this to all of you who are in this fight. Thanks for your expertise. I just really think that The McVeigh program, as it is right now, is a hope for us for a solution in the future because of the human-to-human connection as well. Not just government pamphlets and education kind of things, but literally inserting people back in this to support the dignity of humans as we continue to get to a solution. Thanks for what you're doing.
Thank the gentlelady. Let me recognize the gentleman.